Damaged big toenails are a common problem for people. It's something we see in practice quite a lot. And it seems to cover all the age ranges and covers both genders as well. Damaged toenails, big toenails in particular, can end up quite thickened or unsightly, and they can also end up painful, which is why people usually seek treatment. People can be unsure as to what's caused it in the first place, and that's something that we need to ascertain to see if we can prevent it from reoccurring, if we can solve the issue of the damaged toenail. Tight shoes, ill-fitting shoes, endurance events like marathons or hill walking can all cause damage to the nail bed and change the way that the nail grows and cause it to be thickened or disfigured, or for the nail to suffer some trauma and changes. Quite often though, we have a look at the mechanics of the foot and the way the joints in the foot are working can cause excessive pressure on the base of the big toenail. This joint back here, at the big toe joint, between the first metatarsal and the toe bone, which is the first of proximal phalanx. If we have a restriction in this joint here when we're walking, which lots of people do when it's loaded and they're weight bearing, they don't have an adequate range of motion to get their body weight forward when they're walking. People often compensate by having an excessive range of motion at this next joint. The big toe has two bones in it, and this joint here, sometimes it excessively dorsiflexes, which means that it moves beyond its normal range of motion. It's usually accompanied by a bit of callus or hard skin underneath the toe, sometimes at the side of the toe. And it lets you know that this is banging up like this on each step. Because we've not got enough range of motion here, it transfers to this joint and we get this upward motion. This upward motion does two things. It puts a lot of pressure on the base of the nail here, and it will also hit the ceiling of the toe box in a shoe. Maybe you have a stiff shoe or a tight, tapered toe box, and that can exacerbate the problem. So it's not always just looking towards, is it a fungal infection or has there been some direct trauma? Sometimes it's about looking at the mechanics of the foot and considering, well, how can we change the range of motion at this joint? Sometimes with a simple insole or with a change of shoe type. So what comes in first as a problem toenail can often turn out to be a biomechanical problem.